Hello and welcome everybody. My name is Scott Kellogg and I have Jerry Hafer here with me. We're welcoming you from the AMAC Foundation, which does a series of seminars to hopefully help you, and in this case with some of your Medicare options as you become Medicare eligible. I've turned on the closed captioning, so hopefully you can read along with the presentation. And of course, I think Jerry's going to go ahead and monitor if you guys have any questions. As we can stop and answer those questions. Otherwise, at the end, of course, we'll open up for questions again. So the first thing that I would like to start off with is, what is Medicare and what are some of your options as you become eligible for Medicare? So we were taking a seminar along the lines of what people would normally question as they become Medicare eligible. And the first question that we normally get is, when am I eligible for Medicare? And there are three reasons that you would become Medicare for eligible, the most likely being that you become the age of 65. However, you can also become Medicare eligible if you are under the age of 65, but you are on your 25th month of receiving Social Security disability benefits. The third reason that you can become Medicare eligible is that you're on the 4th month of receiving dialysis for end-stage renal disease. Any one of those circumstances can make you eligible for Medicare. So what is Medicare? Medicare will come to you in 4 parts, or is available to you in 4 parts. And let's talk about the first 2 parts to start with. When we refer to both Parts A and Part B of Medicare, that is the term we use for what we call original Medicare. These parts are not provided to you from any kind of a sales agent. These are actually provided through your Social Security office if you are eligible. And let's start with Part A. Part A is labeled as your hospital insurance. There is not usually going to be any premium due for your hospital insurance, and that is due to your FICA taxes that you have paid over the past 10 years. So although it's not technically free, there will not generally be any kind of premium due. If you have any questions as to whether or not you might owe for Part A, call the Social Security Administration. Part A is going to help with coverages like inpatient hospital stay, skilled nursing facility, and hospice care. Now, Part B of your Medicare is labeled the medical insurance. Now, first know that this one is not premium free. And starting in 2021, the average cost for your premium for Part B services is going to be $148.50 per month. This may be adjusted higher depending upon your income. Now, Part B services are going to cover all of your other Medicare approved services, such as doctor's appointments, testing, lab work, MRIs, etc. Now, both of these parts are available to you through the Social Security Administration. You do not need to go through an agent. But now let's concentrate on Part C and Part D of Medicare. These will necessitate that you either go through an agent or that you sign up directly with the carrier themselves, possibly using the website medicare.gov. Now, Part C is your Advantage plans, and let's discuss what those do for you. These are very much like you might have ever had if you were on an employer group coverage plan of some type, where HMOs or PPOs are generally offered. Now, these private carriers have contracts with Medicare and the federal government in order to provide your Medicare services for the calendar year. So in other words, your Part A and Part B would be covered by the Advantage plan and their terms and conditions. They do replace your Medicare for the calendar year, and barring some special circumstance, you are obligated and contracted to stay on the plan until December 31st. Now, the last part of Medicare, the fourth part, is your Part D, which is your standalone prescription drug plans. Just as with Advantage plans, these are also private carriers. So you can sign up for a Part D plan through an agent or straight through Medicare, and again is for the calendar year. These Part D plans are intended to work for those staying on just Parts A and Part B, original Medicare, because unfortunately Part A and Part B do not cover your prescriptions medications. We'll go into this a little bit further here in just a moment, but I want to make sure that you understand these four different parts of your Medicare options. Again, Part A, hospital; Part B, medical. You can replace both with a Part C Advantage plan, or you can stay on A and B and potentially get a standalone prescription drug plan to cover your drug needs. So even though I'm eligible, do I have to take Medicare? And that's the first question you need to ask yourself, that even though I'm eligible for Medicare, do I really need to take it right now? The answer is that if you have a credible coverage, such as an employer or group plan in place, you can delay your participation in Medicare without any type of penalty. I realize that you are probably getting a lot of mail right now if you're becoming Medicare eligible to tell you about the time period that you have to enroll into Medicare. And penalties might apply if you don't have credible coverage in place. But if you do, you can delay Medicare for as long as you have the credible coverage in place without any worry of a penalty. To let you know that you are likely entitled to Part A on your 65th birthday. And because it becomes premium free, you can participate in Part A and combine that with employer or group coverage to enhance your hospital billing. And potentially between Part A and your employer coverage, most or all of your billing might be taken care of. But you can delay your Part B, which does have a premium, or Part D if you have credible coverage in place. Now just realize that Part B and Part D which is your medical and prescription drug coverage, is considered voluntary, but you may be penalized if you don't have that credible coverage in place. Now, when would a penalty occur? It occurs if you allow this 7-month window to bypass you without signing up for Medicare and not having credible coverage in place. Now, the 7-month window is 3 months prior to your month of eligibility. The month of eligibility usually being your 65th birth month. However, it can be due to disability or being diagnosed with end-stage renal disease. So 3 months prior to your month of eligibility, the month of the eligibility, and then 3 months after your eligibility month is the 7-month window in order for you to decide if you want to participate in Medicare. Now you may ask yourself, how do I start it? Does it get started on its own? Or do I need to take action with Social Security? If you know that you're becoming eligible for Medicare and you are receiving Social Security benefits, Social Security will take the initial steps to provide you Medicare. You will usually receive something in the mail, and it would be up to you to let Social Security know if you do not want to participate in Medicare at this time, especially Part B, since there is a premium. If you are not receiving Social Security benefits, it will be up to you to contact Social Security and let them know that you would like to get your Medicare started. And they will bill you for your premiums. So what are my Medicare options? Now, if you are, the first option that you have is that you can just participate in Original Medicare. In other words, you can decide that I want to participate in the Part A hospital or Part B medical. But there are costs associated with these that you need to be familiar with. Medicare, unfortunately, does not pay for much of anything 100%. And these are some of the costs that you're exposed to if you decide to have Part A and Part B as your insurance. Let's start with your inpatient hospital stay. If you should have a hospital stay, you will be billed $1,408 as a deductible for an inpatient hospital stay. This will cover your hospital stay for the first 60 days. And of course, this is just the facility. There may be further charges for Part B for some of the doctor's services, but we're just talking about Part A right now. If your hospital stay goes over the 60 days, for every day that you're still in the hospital, days 61 through 90, is going to be charged $352 per day. If you are still in the hospital beyond that, for every days 91 through 150, they will bill you $704 per day. And unfortunately, if you are in the hospital beyond 150 days, you're responsible for 100% of the cost. If you need skilled nursing facility, not to be confused with a nursing home, this is more for physical therapy purposes. Medicare will cover the first 20 days at no cost to you. For every day you still need the skilled nursing facility, for days 21 through 100, that is going to be $176 per day. If you need the skilled nursing facility beyond 100 days, you are responsible for 100% of the cost. For Part B costs, remember this is the medical. Annually, you have a $198 deductible to be met. And once you've met your deductible, you'll be in a shared coinsurance with Medicare in which they will typically pick up 80% of the cost and you will be responsible for 20%. This is the exception are things like lab work and preventative services, which are usually covered at 100% if they meet the Medicare criteria. You also might be exposed to 15% excess charges for services rendered by a physician that will not accept Medicare assignment. All right, and I'm just taking a look at some of the chat. Hold on just one moment. All right.
Yeah, all the questions so far, Scott, have been about the interpreters signing in. I haven't seen any real questions.
Right, I just wanted to check on that. Thank you.
Yeah.
All right, so continuing on. Now, one of the nice things about staying on Medicare Part A and Part B is that there will be no network. Unlike the Advantage plans with the HMO or PPO type plans that require networks, if you decide to stay on original Medicare, you can go anywhere in the US or US territories that Medicare is accepted. Now remember that prescriptions are not covered, so those that stay on Part A and Part B for their coverage generally will also participate in a separate Part D plan. There will be an additional premium to cover these needs. One of the negative aspects of original Medicare is that it does not have a maximum out of pocket, meaning that there is no ceiling to what you might be billed. Every dime that you owe is owed to Medicare, no matter how much that turns out to be. One of the options that many of the beneficiaries really enjoy is that they can add a secondary insurance to their original Medicare. And that is what we call a Medigap or a supplement plan. That again is going to be an additional premium to help cover your costs of Medicare approved services. Please know that there are multiple plan options and how much is covered is completely dependent upon how or what plan you choose. Each of the type of plans have different comprehensive coverages. Plans are usually labeled with a letter, and for whichever letter designator comes with the plan, such as Plan G, all of those core benefits are standardized and identical no matter which carrier you purchase that from. For instance, at AMAC, we use approximately 8 different carriers, and we'll look and attempt to find you the lowest cost for a Plan G so that you're paying the least amount for the same coverage. Now, your Part B will still need to be paid to Social Security, because remember that this is only a secondary insurance to your Part A and Part B. You can apply for one of these type of plans anytime that you are on original Medicare and don't have any other type of coverage in place, such as an Advantage plan. However, the first 6 months is very important of when your Part B starts. The first 6 months of your Part B effective date is what we call your open enrollment period. Your open enrollment period allows for you to apply for any of these supplement plans without medical underwriting. Medical underwriting means that they can ask health questions, assess the risk of your health, including your height and weight, and decline you for coverage if they choose to do so. Within the first 6 months of your Part B effective date, this will not be allowed, and you can choose any plan that you're eligible for. There are 10 different plans that you can choose from, but all 10 plans are not normally sold competitively. To also let you know that you cannot combine a supplement or Medigap plan with an Advantage plan. It only works with beneficiaries who decide to stay on original Medicare Parts A and B. So how do I know which Medigap plan works for me? The first thing I would recommend is that you talk to an agent like AMAC, and they will have the ability to compare many prices in your area, especially if an agent is contracted with multiple carriers. As I mentioned before, AMAC has about 8 different carriers across the nation, and whoever of our carriers can offer you a plan of interest at the lowest price is the one that we will quote you. Remember that the coverages are literally identical. So in many cases, all we are trying to do is find you the lowest available price. Cost can be factored also in the fact that if you use tobacco or you might be eligible for household discounts, this might lower or make a higher cost, and an agent can help you out with that as well. Now let's talk quickly about which plans are actually sold most often. And let's start with the Plan F, which is your most comprehensive coverage. Not everyone is available for the Plan F. If your Part A and Part B effective dates are after January 1st, 2020, this plan is no longer available to you. The high deductible F works much like the Plan F, but will not pay for the gaps in Medicare's coverage until the deductible of $2,340 has been met. If your Part A and Part B effective dates come after January 1st, 2020, the Plan G is the most comprehensive coverage that will be available to you. And they also have a high deductible version that also works with a $2,340 deductible. So let's talk a little bit about the Plan F and the Plan G, and then we're going to look at the Plan N. Don't concern yourself with this entire graph, but if you could, look all the way to the right on the Plan F. Just give me a second here. So I've highlighted the area over the Plan F, and again, I mentioned that this is the most comprehensive coverage available. And the reason that is that it will cover all of the gaps in Medicare's coverage as a secondary insurance, and it will add a few things that Medicare doesn't even cover. So if we look at what some of those gaps that are covered are, let's take a look at the left-hand column under the benefits, and you can see what is covered by the Plan F. It's going to cover, first of all of your coinsurances and hospital, and it will add an additional 365 days of hospital stay after your Medicare benefits are used. Remember that Medicare caps out at 150 days, and after 150 days, you pay 100% of the costs. If you have a Medicare plan, or excuse me, a Medicare supplement plan like a Plan F in place, they will actually provide you an additional year of hospital coverage beyond what Medicare covers.
Scott, we had a question here. Do all do all out-of-pocket expenses across plans count towards the deductible for Medigap?
Well, it depends on, well, we had the question. So Jerry, the question was it all Medicare related expenses count towards the deductible?
Well, do all out-of-pocket expenses count towards the deductible for Medigap?
Do all out-of-pocket expenses count towards the deductible? And if I understand the question right, remember that both Part A and Part B both have their own deductibles. So again, the hospital deductible is $1,408. The Part B deductible for medical services is $198. If the question is towards the high deductible Plan F or Plan G, every one of your out-of-pocket expenses goes towards that deductible. In other words, I still have Medicare as an insurance from day one. As I'm being billed for anything, any Part A or any Part B service, all of my expenses are being added up in the calendar year towards that $2,340 deductible. And once my out-of-pocket expenses have reached that $2,340 is when my high deductible Plan F or high deductible Plan G become active. And for the remainder of the year, they will pay the gaps in coverage. Does that seem to answer the question that was posed? We'll give him a second.
I think so. Yes, he said thank you, so.
Okay, great.
Good.
Going over the coverages, continuing with the coverages that you would purchase if you purchased a supplement Plan F, it's also going to cover all of the Part B coinsurances or copayments, which is the 20% that we talked about. It will cover the first 3 pints of blood Medicare doesn't provide for. It'll pay for all of your Part A hospice care coinsurances, skilled nursing facility. It's also going to cover both your Part A and Part B deductible amounts. It will provide for your Part B excess charges and add some foreign travel emergency. Now, these do have some plan limits, but if you find yourself outside of the United States within the first 60 days of your trip, if you need emergency care, you can receive it out of the country. It will come with a $250 deductible, but then your plan will pay for 80% of the billed charges up to a lifetime limit of $50,000. Now, the supplement plan is not going to add prescription drugs. Remember that you're not going to get prescription drug coverage from original Medicare's Part A and Part B. And the fact that you added a supplement plan is only there to cover the gaps in Medicare's coverage, to help you cover the things that you would normally be billed as you use your Medicare as your primary insurance. If you need prescription drug coverage, you still need to add a Part D coverage. Now let's talk about the Plan G real quick, and I'll highlight that one right here. And Plan G is almost identical to Plan F. And as a reminder, if you have Part A and Part B effective dates of January 1st, 2020 or beyond, the Plan G is the most comprehensive coverage you can now purchase. The only difference between Plan F and Plan G is right here, and I'm going to go straight to it, is that your Part B deductible of $198 is not covered under the Plan G. Many people ask, why is it no longer available to me if I'm new to Medicare? And the answer is that by law, any plan that covers your Part B deductible is no longer eligible for those new to Medicare. It was one of the most recent changes and started in 2020. Now, quickly, we'll go over one other plan that is very viable and purchased often, is the Plan N. The Plan N is very similar again to the Plan F, but we'll discuss the differences. The first difference being that they also don't cover the Part B deductible, but it will also not cover those excess charges. We mentioned briefly what that is, but there are some doctors who will accept Medicare, but not accept what we call Medicare assignment. And for those doctors that don't accept Medicare assignment, they might be able to do what we call balance billing of up to 15%. With this plan, if you are charged excess charges, it will not be covered under the Plan N. The other thing that makes the Plan N different than the other two plans we discussed earlier is that it does have co-pays of $20 for some of your office visits. And it also has a $50 copay for emergency room visits that don't result in inpatient admission within the first 24 hours. Those three plans are most likely going to be the plans that you would discuss with an agent, but all of those plans might be available to you. Just know that if you want your agent to seek out a different plan that we talked about today, it may not be competitively priced. Carriers are not interested necessarily in selling all 10 versions of these different plans. So you may find that you're paying more for less coverage because the carrier's not particularly interested in selling some of these plans. Any questions so far?
Nothing right now.
Okay. So what are my Medicare options? The other option beside just staying on original Medicare with the option of purchasing a supplement plan is that you can decide to participate in an Advantage plan. And remember, Part C and Advantage plan mean the same thing. If you decide that an Advantage plan is the way that you would like to go, know that you are agreeing to have this private carrier cover your Medicare needs for the calendar year. In other words, instead of those prices we talked about earlier for Part A deductibles and Part B deductibles and 20% coinsurance, you've now agreed to pay the terms and conditions from the private carrier. Now, these Advantage plans generally will have a lower premium than your Medicare supplement plans, but there will still usually be costs associated with the services performed. For instance, you may have, and these are just examples, a $20 copay to see your primary care, a $50 copay to see your specialists. A hospital stay may be, say, between $100 or $300 a day for the first 5 to 7 days. X-rays will be a preset of amount of, say, something like $75. Now, of course, these are just examples, but it kind of gives you an idea that even though you're not paying on Medicare's terms and conditions, these plans have their own terms and conditions. And in some cases, you may find that you pay more than if you would have stayed on Medicare. And in some cases, you may find the service costs less than if you would have stayed on Medicare. Please know that if Medicare provides a service for hospital or medical needs, your Advantage plan must, by law, also provide that service. It's just that the cost might be different. As I mentioned before, premiums for the Advantage plans are generally much lower and may not cost you any additional money. This is where you've seen many of the commercials that have come up or coming up right now for the annual enrollment period that talks about many of these plans available to you for no charge. And technically, you're still paying for these plans because you have to keep your Part B in force with Social Security. Remember, that's the $144.60 per month that you'll be paying as a monthly premium on average to Social Security. The money is just diverted to the private carrier, so you don't have to usually pay the private carrier any additional money. Now, this isn't a promise that it's going to be $0, but it is common that plans are available for $0. Now, one of the nice things about a Medicare plan is that overstaying on original Medicare is that it will generally include things that Medicare doesn't normally offer to cover. And here are some examples on this slide. Medicare isn't normally comprehensive in the areas of vision, dental, or hearing. But many of the Advantage plans, in order to tempt you to purchase one of their products, will generally offer you these additional benefits that Medicare doesn't provide for. Medicare will cover medical necessities for vision, dental, and hearing. For example, were you to get into a car wreck and perhaps you lost some teeth or broke your jaw in this car wreck, then Medicare would generally help cover those costs because it's a medical necessity. But for things like teeth cleaning or cavities or bridge work, those items are not generally going to be covered under Medicare itself. But if you go with an Advantage plan, you might have additional coverages towards those comprehensive areas that Medicare would not normally cover. Another nice thing about Advantage plans is that they generally have wellness coverage added. Many people have heard of things like Silver Sneakers or Silver and Fit, and those are programs that allow you a free membership to some of your local area workout facilities in order to participate at no additional charge to you. They also usually add the prescription drug coverage within this plan. So you don't have to purchase an additional Part D standalone prescription drug plan at an additional premium because the drug coverage is included with your Advantage plan. If you are participating in a $0 plan, this would mean that you're not having to pay anything additional to have your prescription drug coverage in it as well. Probably one of the most important things an Advantage plan offers you is that they have a maximum out-of-pocket. What this means to you is that if your out-of-pocket expenses reaches a certain limit, that the plan will then cover 100% of the remaining costs as long as it's one of their normally approved services. The only thing left that you would have to pay is your copay or coinsurance for an over-the-counter medication of some type or your premium. Right now, the maximum an HMO plan can have is $6,700. So I just want to remind you that if you go on original Medicare's Part A and Part B, there is no maximum out of pocket, and you are responsible for 100% of your portion of costs. If I have an Advantage plan in place, then the worst my year can be financially in an HMO plan is $6,700. Now, this is the maximum a plan can have. It doesn't mean that many plans don't even offer lower maximum out of pockets in order to be competitive against other carriers. All of these plans are subject to Medicare's 5-star rating system. So if you decide to shop on your own for an Advantage plan and go to, for instance, Medicare.gov's website, from there you will see that each plan has a star rating, rated 1 through 5. And this is a good, convenient way for you to be able to compare the plan's effectiveness based on a lot of criteria, such as doctors in the network, price, costs, customer satisfaction, and allows you to weigh one plan over the other. However, it is still a good idea to look at that plan and find out the costs associated with some of the normal benefits, such as seeing your doctor or staying in the hospital. The ratings may change each and every year, so just be aware of that. If, when you become first eligible for Medicare, you participate in a plan, be aware of the dates of October 15th through December 7th. This is what we call the annual enrollment period. It allows you to make your yearly change to your plan if you choose to do so. This is the time of year where all the commercials will be pouring into the television and advertising their different plans, and you can compare your current coverage to coverage against next year and determine whether or not you want to make a change. You don't necessarily have to make a change. If your plan rolls over to next year and you don't take any action, you will automatically just stay with that plan for the next year. If the plan is not going to renew, they will always advise you that the plan is ending, and then you need to make sure that you use the annual enrollment period to enroll into a new plan. If you don't, you will likely return to original Medicare and might have to wait an additional year before you can get back into an Advantage plan. Any questions so far? So when we talk about these Advantage plans, primarily they're going to be offered as an HMO or a PPO style coverage. And I want to make sure that you're aware of the differences between these style of plans. And we're going to start with the HMO, which stands for Health Maintenance Organization. Now, your HMO plans will generally require that you use a primary care physician. It has to be designated, and you generally will have to go to your primary care physician to receive referrals to see specialists. If you don't follow the plan's rule for services, such as staying within the provided network, you will most likely have to pay for your own coverage. So in other words, HMOs require that you stay within the established network for routine care. They will cover emergency and urgent care services out of your area. They'll also cover things like out-of-area renal dialysis for things like permanent kidney failure or end-stage renal disease. But routine care must be within the HMO's network in order for it to be covered. The PPO plan stands for a preferred provider organization, and these will generally be more flexible. They will let you go to a doctor or hospital that accepts Medicare, but know that you will generally pay a higher price for going out of the network. So just like with the HMO plans, there is a network established. However, this plan allows you to go out of the network. Now, they typically will not require that you use a primary care physician to see specialists, but sometimes your premiums, your copays, or your coinsurances might be higher than some of your HMO options because of the flexibility that they're affording you. These are plans that are generally looked for people who spend a long time outside of their home network coverage area. For instance, snowbirds, those that might live in New York and come to Florida for about half of the year to live, might need a PPO plan in order to establish a doctor they can see outside of their network while they are away from home. So how do we determine which type of plan works for you? And I set an example of the snowbird, but we need to just determine your lifestyle. Do you travel a lot? Do you travel for long periods of time outside of your home network? Are your doctors important to you? Remember, these are all network style plans. So generally we try to determine before you enroll as to whether or not your doctor is in the network. Will the plan cover your medications? As an agent, we always try to take a look at your medications. Of course, it's voluntary, but we try to determine which of these plans can cover your medications at the lowest cost to you and also allow you to use the pharmacy of your preference. And then overall, are you satisfied with the costs associated with the Advantage plan? Am I agreeable to the copays or coinsurances listed in the plan's summary of benefits? These are all things that an agent can assist you in doing, but you're welcome to do on your own as well. Anytime that you'd like to go to Medicare.gov and look at the website, you simply need to put in your zip code. It will ask whether or not you want to input your medications, and then a list of plans local to your area will be provided to you. Each one of those plans have an ability to look deep into their costs and even enroll yourself if you would like to, as long as you're eligible for Medicare at that time. Any questions?
Scott, there is one question in the Q&A area. Can you change from original to Advantage from year to year? And I guess it would be good to explain the process for how you do that.
Sure. So the question is, can I switch from original Medicare to an Advantage plan year to year? The answer is yes, as long as you're eligible to disenroll from the Advantage plan. As I had mentioned before, your Advantage plan is a yearly contract and runs until December 31st. If at the end of the year you decide that you want to return to original Medicare's Part A and Part B, you would simply notify your Advantage plan that you will not be participating with them next year. So on January 1st of the following year, you would return to original Medicare and have the opportunity then to pick up a standalone prescription drug plan to continue to cover your drug needs. Did that answer the question? I'll give them a moment to have any follow-ups. All right, so I want to summarize where we were. I know it's a lot of information, but I do want to make sure that we kind of re-summarize it for you so that you understand what your choices are. And the first one again is decide if you even want to go on to Medicare. You can call an agent and compare your employer coverage to what Medicare has to offer, weigh out everything as far as what penalties you might be assessed, whether you're going to get penalties at all, and whether or not Medicare might be a lower cost and more comprehensive coverage than your group coverage is. But always be aware that as long as you have group coverage in place and it's considered credible coverage, that you can delay your participation in Medicare for as long as your employer coverage is there. If you drop your employer coverage and go on to Medicare, we always try to make sure to advise you that you need to understand that you may not be able to get your employer coverage back once you make that move. That is something you should talk with your HR department about. So if you decide that you want to go on to Medicare, the next thing is, can I be on Medicare and combine that with my group coverage? And you can. You can have both Part A and Part B and group coverage. And between the two, they coordinate. One will pay primary, one will pay secondary. That decision who pays primary or secondary is based on how many employees are in your company. Regardless, between the two coverages, all or most things might be paid for. Now, just realize the drawback to this is that your Part B has started and you can't get a supplement plan because you have group coverage and Medicare, and you're losing more than likely that 6-month open enrollment window that allows you to get a supplement plan without medical underwriting. Call an agent and they can discuss all the details with you. If you decide to join Medicare, you can either just stay with original Medicare's Part A and Part B, and then add a Part D standalone prescription drug plan and or a Medigap plan to help you cover those costs that you would normally be billed, or you can elect to have an Advantage plan. Unfortunately, you can't have them both at the same time. So again, you can choose to stay on Medicare and assist your costs with a secondary insurance known as a supplement plan, or you can decide to have all of your Medicare needs met by a private carrier's Advantage plan, normally known as an HMO or a PPO style plan. So with that, I realized that that was a lot of information, but I'm open for questions that anybody might have to try to make sure that the information that was provided is clear to you on what your options are as you make decisions to go on to Medicare.
Okay, if there are no further questions, then we will close out the webinar. And again, Scott, thank you very much.
You're welcome. Thank you, everybody. You have my information on the screen. If you need to contact for any reason, my email's on there. Feel free to write me an email and certainly answer any questions.
Okay, great. Thank you, Scott. Thank you, everybody, for joining us, and hope to see you soon.